So what is Invisalign? Well, it's the most advanced clear aligner system on the market. They've now treated over 10 million patients, have been around for 15 plus years, so they have so much knowledge of how this system works. And nowadays the system is so advanced it can pretty much treat any type of orthodontic problem. So what I'm holding here is an Invisalign tray. You can see they're very thin. They are custom made to fit around your teeth as precisely as possible, which makes them very comfortable. When we start your treatment, we would take a digital 3D scan, and that is where we are starting from. I will then plan how we want your teeth to be at the end. And what happens is the aligner sequence is generated. So for example, we know if a tooth needs to move, let's say 1 millimeter, we know we need about 10 aligners to move that tooth. So we work that all out, and then all of your aligners are 3D printed. So you have one aligner, which you wear between 1 to 2 weeks. You would then put your next aligner in, wear it for 1 to 2 weeks, and so on, until you've come to the end of your aligners. Now, a lot of people still come in and ask, can it treat this, can it treat this? And the answer is yes, it can. Okay, it all depends on who you go to see, but nowadays Invisalign has the capability of treating every type of issue. So we spend a lot of time with our patients here, talking to them, asking the questions they want to, asking them what sort of things they want to fix, and then we can make the Invisalign plan bespoke to you. So the main benefits of Invisalign, so as you can see, because they are transparent, they are as inconspicuous as any type of brace can be. Compare this to having fixed metal braces. Of course, this is going to look much more aesthetic, which is why nowadays a lot of people have it because they feel comfortable having the aligners in, because there's no longer a taboo of having orthodontic treatment as an adult. Because you can take them out, it means that you can clean your teeth as well as you would normally do. A big benefit compared to, let's say, fixed braces. As you can imagine, having the metal wires and the brackets on your teeth, it will make it harder to clean. So by having Invisalign, you don't have any of those issues. You also therefore take them out to eat your food, which again is a big benefit, because it's not nice having the metal brackets on your teeth because you get food stuck in between them. Whereas obviously with the Invisalign trays, you're taking them out to eat, so you don't have any of those issues. The other main benefit is that it works very quick. So a lot of patients are pleasantly surprised when I tell them that their treatment might only take 6 months, whereas orthodontic treatment usually takes longer than that. Fixed braces take longer than that. It's all to do with how the biomechanics of these aligners work. And if you go to the right dentist who is planning the treatment properly, we stage the movements so that they should all work as planned in a nice gentle fashion, so that they move as quickly as possible within a safe limit, obviously. And on that point, because each aligner is being worn for a week to 2 weeks, they are planned, pre-programmed to move your teeth a little bit per aligner. So you're never going to be walking out of here in really discomfort where you've had to have things tightened because you were changing these at home by yourself. So each time you put a tray in, it feels a little bit tight for a day or two, and then for the rest of the week it becomes more and more comfortable until you put your next tray in where it feels tight again, and a few days and it feels more comfortable. It's funny, a lot of my patients, and I did Invisalign myself, you almost look forward to that tightness because you know it's actually moving your teeth, which is obviously what you want to happen. So that for me are the main benefits. Quick, comfortable, easy to clean your teeth, you can still enjoy the foods you want to enjoy, and there's much less discomfort with Invisalign.